Again, welcome to our live webinar on how do you manage your team post-COVID-19. This is Jim Gerson from CareStack. Let's get started. I want to welcome everyone to our webinar series today. Hopefully you're safe and sound. And if your dental practice has reopened, thank you for joining us. A couple quick housekeeping items. You're joining this webinar today in listen-only mode. However, we do want it to be interactive. So you will see the Q&A feature on the bottom of your Zoom panel if you're using a traditional PC or Macintosh. If you're using an iPad today, it will probably be in the top of your panel for Zoom. And so if you do have questions, we intentionally created a Q&A section at the end of the webinar to answer those. And if you'd like, you can also raise your hand and we have the ability to unmute you, but then you will have to unmute yourself too as well, and you can ask questions of the panel. So thanks for joining us. Jim Gerson here from CareStack. I'm going to get started. A quick little note from our sponsors today. I represent CareStack. We're a 100% cloud-based solution for the complete management of the dental practice. We're not a well-known name out there because we're a nascent organization. So I have some facts and figures up here that talk more about us as a company. But we typically work with two types of clients. The first is the dental practice that wants to offer a contact-free or touchless experience for both their patients and their staff, and they just need some help. They see technology as enabling it, and they just don't know how to get there. The second type of client is the one that's grown frustrated and aggravated by managing a multitude of subscriptions to run their dental practice. For example, one for parking lot or curbside check-in, another one for patient reminders, another one for forms to be completed at home, another membership for the digital clipboard, right? No one wants to handle the traditional clipboard anymore. The list goes on, and these practices have grown really aggravated, and it's led to sleepless nights. So hopefully you find yourself in one of those two buckets, and if that's the case, please visit us on carestack.com and request the demo, and we'd be happy to share more with you. I'm going to now turn it over to my colleague, Jeff Daly, who will speak a little bit about Darby Dental.
Sure. Thanks so much, Jim. And thanks again, everybody, for making some time for today's presentation. We're really excited to partner with this awesome group of panelists as they help provide some really valuable information around managing your team and this new reality that we all face. So Darby's shameless plug, and then we'll move on to the content. What you may already know about Darby is that we partner with our customers to help keep their dental supply costs down. What a lot of offices are surprised to learn is that over the past 10 years or so, we've been hard at work building a suite of solutions that help resolve the challenges our customers tell us they face on a daily basis. So today, those solutions include things like IT services, mechanical equipment service, and a number of others. Finally, and maybe most salient given the times, is just a reminder that for our entire 70+ year history, all of our account managers have worked completely remotely with our customers. So in today's world, that means no extra bodies walking into your practice, no extra feet, stomping onto the carpets. And we're happy to say that we've been able to keep our full team here and ready to, and able to support our customers. So if there's any way we can help your practice or you're interested to learn more, please feel free to reach out to any one of our account managers. With that, I'll turn it over to Lynn from Black Ops Management to kick us off and get us started.
Thank you, Jeff. Lynn Campbell here, of course, with Black Ops Management Solutions. Black Ops Management Solutions specializes in supporting, as you can see on screen, the dental support organization and the invisible DSOs, or the offices, dental offices, where doctors are needing the extra support from centralized services. And so with that, I'd like to definitely share my appreciation to both CareStack and Darby for their consistent support in navigating informative resources, if you would, to our clients and friends. And so thank you both, Jim and Jeff, and supporting us today. Today's presentation is really more around question and answer. We've been receiving so many questions in regards to navigating, if you would, and building confidence back in our staff as well as in our patients, especially now since COVID-19. COVID-19 has changed the landscape of dentistry as we knew it and our dental practices. And so now we're faced with multiple challenges as we reopen and try to get back to some form of new normal. So it's crucial, very crucial that we provide both our staff as well as our patients some confidence in coming back to our practices. So in our two-part series today, we're going to speak specifically in the space of our team. It's our team post-COVID. So in most cases, we brought our existing team back, and in some situations, we have new members coming in for the very first time. So, we've got some work to do there. So with that, I'd like to introduce, if I could, I'm going to introduce both of our specialists today, our subject matter experts. Lauren Mansour, she's going to introduce herself. And then, of course, Jordan Stern will be second. And then, as I made mention, we're going to go into question and answer. So Lauren, introduce yourself.
Of course. Thank you, Lynn, and we appreciate the opportunity to be a part of this today. My name is Lauren Mansour. I'm an attorney with Oberman Law Firm, and we specialize in representing dentists across the country. We provide representation for both practice acquisitions, buyouts. We do a lot of compliance law, employment law, so we try to cover doctors from every stage of practice ownership.
Thank you very much, Lauren. And Jeff, go ahead if you would and introduce yourself, and then we'll get into some Q&A.
Yeah, sure. Thanks so much, Lynn. This is Jordan Stern here. I'm the vice president here at TAG Employer Services and eBacon. We are a full-fledged administrative service organization. We work with a bevy of dental practices, and we work in the line of segment of HR compliance, payroll, time and attendance, and the full length of back office solutions. Very excited to be here to talk through some of these questions and obviously give you some high-level information on how you might be able to handle some issues and or problems moving forward in our new normal.
Jordan, thank you. Well, let's get started. Lauren, one of our very first questions that has come in definitely has been in the space of what do you do if an employee refuses to return to work? They desire to stay home, remain on unemployment. So Lauren, if you'll take that, give us some update of what we can do if the employee refuses to come back because of the extended unemployment.
Sure. So we are getting this question quite often, and there are a number of our clients that are dealing with this. So first, if you do offer reemployment to your employees at the same wage and number of hours that the employees worked prior to any COVID-19 furlough or shutdown, then they are likely no longer eligible for unemployment. So some of our clients have employees who are just requesting to stay home because they'd rather not come back right now and that they want to continue receiving unemployment, and it's just not possible in most circumstances. So the Departments of Labor have advised employers not to file any unemployment or partial unemployment claims if an employee is electing not to return to work. So if an employee is requested a leave of absence, and there's some other laws that we'll get into regarding that, but if they are voluntarily out of work, if they self-quarantine, if they've quit, no longer can you file any partial unemployment claim. The employee certainly could file their own claim, and the Department of Labor can determine whether or not they're eligible for benefits. But it's no longer the dental office that does that on their behalf. And so hopefully that also helps with the offices in which employees believe they can continue to receive that payment and just not report back.
Lauren, thank you for that. So I'm going to swing this over to Jordan now and take it more into an HR space. So as the employer, can I reduce the employee's pay for hours or both to bring them back?
Phenomenal question, Lynn. So there's a lot of dependency on whether they're going to be an hourly non-exempt employee or if they're salary non-exempt. The question to all of them is hourly non-exempt, 100%. They work for whatever hours they work, and you pay them for the hours they work. If they're salaried non-exempt, if they work any part of that week, they need to be paid for that week. The one caveat to that would be if they take an absence by their own reconnaissance, then you do not have to pay them for that time as well. There's a lot of stipulations, a lot of laws, and Lauren can definitely speak through all that. But on the HR side of the fence, if you are in fact going to be reducing pay, just make sure that you're ensuring the salaries still meet the new salary threshold. I believe in most states it's above $35,000. Make sure you're keeping up with that. And then there's other options that you can make from the HR capacity. These are kind of the gray area. Now, if you are going to change a salaried employee to an hourly employee for the purposes of lowering their pay, you're going to want to have that conversation prior, and you're also going to have the expectation that it might not go very well. But at the end of the day, from an HR capacity, the goal is to be on top of things, have a standard operating procedure for how you're going to give this information, and also how you might deal with some pushback. So from the HR capacity, make sure you have your laws in front of you, make sure you have your communication structured, and make sure that you are keeping track of everything you were discussing, and make sure you have an HR management system to do so. If you don't, please notate as best you can, but an HR management system would certainly make this a much easier process for you.
Jordan, thank you. So what I hear is documentation. This is one of those areas we do have to document, and having a resource is great, but if not, at least documenting. Document,
correct.
I'll go back to Lauren then and ask this, as we've just learned, and as the conversation was, if an employee is refusing to come back to work, for whatever reason they are refusing to come back to work, we are reopened, we're trying to see patients at the capacity we were seeing patients as close as we could before, can I actually, as the employer, terminate the employee? I've given them every chance, I've given them the letter to return them from furlough or bring them back in, for whatever reason they wish not. Can I make the termination?
So yes, but that answer is qualified, because if the employees do not request sick leave or leave under the Emergency Family and Medical Leave Expansion Act, or the employees request and are eligible for such leave, but the practice is exempt from compliance, then you can terminate them. If the employees, however, request sick leave and are eligible, and we can discuss that a little bit later, then you have to make a determination as to whether your practice is exempt. Most dental offices do have less than 50 employees, and so they may be exempt from providing any leave, especially paid leave, if the practice has determined that the practice's expenses exceed available business revenue, and it has to cause the practice to cease operating at a minimal capacity in order to provide such paid leave. So that's the first criteria. The second is the absence of the employee requesting that paid leave would pose a substantial risk to the financial or operational capabilities of the practice because of that employee's specialized skills. So if this is a hygienist that's requesting some paid leave, and of course this is a specialized employee, and you need this worker to continue operation of your practice, then you may be exempt if you do fall under the 50 employees. And the third criteria is they're not sufficient workers who are able to fill that employee's duties. So if one of those three conditions apply, and again, it's a fact-specific case-by-case analysis, but if one of those apply, then the small business exception can be elected, and it's just documentation that you keep for your own files, no need to report it anywhere else. And in that event, then yes, you can terminate employees that are refusing to come back to work.
Lauren, thank you. And again, it's a lot of documentation, it sounds like. We're navigating through this. Well, Jordan, I'll come back to you and ask this question, and it's the, where we're now wanting to come back to work, but as the employee, I'm refusing to come back because I'm fearful of being infected with coronavirus, or I'm fearful of some asymptomatic person working in our dental office. And so at the end of the day, I don't want to come back because I am afraid. So can you terminate the employee? What actions from an HR standpoint do we take? And Lauren, we may need to come to you afterwards as well from a legal standpoint.
No, I think these are excellent questions. I'm really lucky to be participating with Lauren because she covers the legal gamut, and I can cover the HR gamut, which is HR and legal. They work hand in hand, but at the same time, there's a lot of different sources of explanation. But to answer your question, Lynn, the answer is yes. And under OSHA, an employee may refuse assignment that involves a risk of death or serious physical harm. As a company, your main goal is to ensure that you create a place of safety and wellness. There's a lot of OSHA guidance and preparation of workplaces under COVID-19 that can be assessed, but each situation will be varied and different. But on the HR side of the fence, make sure that all the facts are always reviewed. The potential for an ADA reasonable accommodation is made if there's a disability involved. But most importantly, look at all scenarios. Is this an individual that can perform work virtually? Is this someone that has to be on site to build in to the revenue of the business or contribute? If the employee refuses to return to work, employers should carefully document, and yes, Lynn, I'm going to say document about 1 million more times, document the offer of the employee's reason for refusal. Most states' unemployment sites provide a page where you can report the refusal to work or just kind of diagnose it. But there's a lot of OSHA guidance on this as well. I believe A41 is the OSHA guidance for COVID-19 regarding this. I'm sure Lauren can speak even more diligently towards it. But the number one goal, assess, understand, and communicate. From the HR perspective, if you're covering those three initial communication tactics, you're going to have people that are at least informed and comfortable with whatever decision is made. Other than that, there's legal reform for everything.
Jordan, thank you. I'll share a little bit of time. Lauren, if you would, anything from a legal standpoint with the same question. I'm just not comfortable in coming back. I'm fearful that coronavirus is in the practice. There's asymptomatic in the practice, and so I'm fearful of coming back. Anything from a legal standpoint you'd like to add to that?
Yeah, I mean, we are seeing that a lot, and it's, again, fact specific, because a lot of our dental offices, you know, they need these employees back, or they need to hire other team members. And so there have been terminations as a result of this. I mean, if the employee is pointing to something specific, there's some regulation that is not being followed, then it's something that needs to be considered. I mean, there's OSHA regulations, of course, CDC recommendations, state law sometimes conflicts with both of those. And so kind of an analysis needs to be made. Of course, we also have OSHA complaints that have been filed against some of our clients by employees that have not yet come to the practice, but because they want to continue to stay home and they're afraid to come back. So certainly we have to be very careful of that. There cannot be any retaliations. There's protection against anyone that files a complaint. But you know, employees are entitled to refuse to work if they believe they're in imminent danger. And OSHA defines imminent danger to be some danger that reasonably can be expected to cause death or serious physical harm immediately, or before the imminence of that danger can be eliminated through enforcement. So, you know, frankly, if you are not providing any PPE and you are treating all of these patients, it may rise to that level where the employee can legally refuse not to work and may have some protection. But if offices are complying with the regulations that have been set forth, then there's a lot less risk.
Lauren, thank you. And we know our audience is going to be very compliant. They've been trying to get PPE for quite some time now. So I'm sure we're over compliant, but that's a good thing. So I want to expand in, Lauren. One of the questions that is coming in, it's not one, but it's many people have been asking the same question. Not all states have opened back up. So we do still have some daycares that are closed. We still have schools that are closed in areas where school would still be going on. So there's been some hardship on an employee navigating between daycare, public schools or private schools for their children, and getting back to work. So walk us through that from a legal standpoint. What does that look like? And I'm sure it's different state to state for the states to be reopening. So share with us a little bit there.
Sure. So the Families First Coronavirus Recovery Act does require certain employers to provide employees with paid sick and emergency medical family leave for specified reasons related to COVID-19. So these provisions apply through the end of this year, through December 31st of 2020, and covered employers refer to certain public and private employers with fewer than 500 employees. Small businesses, like we previously discussed, with fewer than 50 employees may qualify for an exemption from the requirement to provide any paid leave. And so definitely those three criteria that we just discussed are going to be crucial to determine whether or not you need to comply if your workers cannot come back because they have kids at home and daycares are closed. So if you do think that your practice is not exempt after making that analysis, then a full-time employee is eligible for up to 80 hours of sick leave, and a part-time eligible for equivalent of 2 weeks of sick leave if there's someone in the home that is sick that would qualify under the Families First Coronavirus Act. But if it is because of a caring for a child that is not able to go to school or a daycare, you need to verify. There's steps to take about, is the child enrolled in this daycare? What is the age of the child? And we suggest weekly reports from the daycare that they are still closed. But provided that you get that, then they're eligible for up to 12 weeks of leave at 2/3 of their pay. And it's up to $200 per day is the cap. So covered employers that do pay out this sick leave are eligible. They qualify for a dollar-for-dollar reimbursement through tax credits for any qualifying wages paid.
So thank you for that, Lauren. And we're going to navigate. Let's look a little bit forward here. In those particular counties, if you would, school is out and daycares are back open in cities and in some counties. But then there's also the conversations within those same cities or within those same counties that there will be no public school until until January of 21. So as we're walking into the back half of the year, we've gone through the summer break, but now it's school time, there's no school. So would we be following the same guidelines as we go into the August, September timeframe and we see that there's no public school? So it's the verification that we would need to be doing and navigating through that?
Yeah, so it's the same guidelines, but in any event, the leave is up to 12 weeks total. That's the maximum amount. So once you've provided all of that leave, there is no more paid leave required. And so it would be capped at that point. Of course, in the summer, there's no school, so it's the daycare eligibility throughout this period. And again, yes, if the practice does not qualify for an exemption, then they would have to give up to 12 weeks of paid leave.
Lauren, thank you. I think we're getting our money's worth today for sure from a legal standpoint, so thank you.
Lynn, sorry to interrupt here for one second. I just want to mention to the audience, as we've had a couple of hands go up, and that's great. We're going to have time allocated to question and answer, and we'll open lines to at that point. So if you do have a question, you can either use a Q&A field here, and we'll put them in a parking lot until then, or we will allow people to unmute themselves when we're done with the presentation. So, sorry to interrupt there.
No, Jim, thank you. Yes, please ask your questions. We know that questions are coming in also around PPP, and we are going to be answering some of those questions, especially with the expansion. So we do see that that's coming across as well. So thank you guys for asking your questions. I do want to go to Jordan. So Jordan, we've navigated through, if you would, the employee not wanting to come back, the employees are coming back, but now let's look at reality. We are in business, we're seeing our patients, we are providing social distancing, we have our PPE, we're doing everything that we need to be doing in our dental practices, but we do come in contact with someone that is actually presumptive positive with COVID-19, or we have someone within our circle that is presumptive positive. What, from an HR standpoint, should we do? What actions should we take? What documentation do you anticipate we need?
Terrific question. This is something that has come up pretty regularly with a lot of our clients, and for the better part of about 2 months, I've had daily conversations with my clients on this, and we're pretty lockstep in terms of our standard operating procedures. So if this does come about, if you should have an employee suspected or confirmed to have COVID-19, in most cases, you don't need to shut down your facility, but do close off any areas used for prolonged periods of time by these sick people or persons. The goal is to wait 24 hours before cleaning and disinfecting to minimize potential for any other employees being exposed to respiratory droplets. And if you have to get it done, at least try and wait as long as you can. During this waiting period, make sure that you open up doors, windows, increase air circulation. Make sure you get as much of that done as possible. And remember, follow the CDC cleaning and disinfection recommendations. If you want to hire or outsource hazmat, do that. Otherwise, You need to really follow this step by step. Get the gloves, get EPA related material. If you don't have it already, you're missing out. You gotta be ready for those. And for most workplaces, you should already be following the public health recommendations related to community-related exposure. There's a lot of frequently asked questions about that. There's online resources. I'm always a resource. I have a full staff that does nothing but this. And the biggest question I've been asked recently is if you have employees that are exposed but not showing symptoms, should you allow them to work? Lynn and I have talked about this before already. If you suspect them of being in close contact with multiple members of your staff, better be safe than sorry. Potentially, if they've been exposed, ensure self-isolation. If they don't have symptoms, still try and have them remain at home for at least a minimum of 14 days. If they experience any symptoms, that's when we go to the next level, and we can have a full level of standard operating procedures on how to handle. But the main goal I'm trying to share today is you need to have a listing of standard operating procedures for when this happens so that you can follow them, communicate them to your staff members, because if you're not communicating what's going on and how you're handling it, you can create quite a firestorm. I'm sorry if I rambled a little bit there, but this is really important stuff that you need to have tightened up.
Well, Jordan, we're going to have you ramble a little bit more because you stress something and it's evident, right? Our employee handbooks, we know these as our SOPs or our standard operating procedures, but not that it's changed just because of COVID, but so much has caused us to revisit our employee handbooks, revisit our infection control manuals, if you would. We're getting from CDC, from the ADA, we're getting so much thrown at us right now, and there's interim, if you would. Are there some particular policies, and Lauren, I'll tee you up as well, because I'm sure from a legal standpoint, you can speak to this, but Jordan, from an HR standpoint, what should I most importantly be revising in my employee handbook right now today as my employees are coming back, if you would, and we're reopening the business?
Excellent question. The first thing, there's 3 main topics you need to address in your handbook, and you need to ensure that all of your employees acknowledge that this is a change that has been made to your handbook. I can't stress this enough. A lot of departments, they make a change, nobody reads it or acknowledges it. It's like it never happened. They need to have this acknowledged. The number 1, they need to have the CDC recommendations for what needs to occur if and when there are any COVID-related symptoms or issues at the company. The next item that needs to be covered is anything related to the Americans with Disabilities Act. So if in your place of work there is not ADA-related material for anybody that might have any disabilities in dealing with COVID-19, this needs to be added right away. And the last piece of information is PPE or anything related to preventing anything that's going to happen at the company and how to handle it on the post-haste. So with handbooks, it's all about acknowledgement, but more than anything, it's about reiterating this is covered, we have steps, we have standard operating procedures. And I'm teeing up Lauren because I'm sure she's got a laundry list of beautifully termed legal items that really do need to be covered. So Lauren?
Sure. So, and I think I want to follow up too. We agree with all of those recommendations with respect to if an employee tests positive for COVID-19, we're also now having clients with patients testing positive and notifying the practice. And like Jordan said, kind of asking the infected employee to identify anybody that's worked in close proximity for a prolonged period of time with that employee so that you're able to send everybody home that needs to be sent home safely. It's also important not to identify the employee by name in a small office. It's going to be probably pretty clear who was exposed, but or who tested positive, but you risk violation of confidentiality laws if you're sharing the name of the infected employee. So, of course, your employee should follow healthcare providers, public health department guidance to stay home and for the number of days to stay home. It's also sometimes a good idea to communicate with vendors, and also if you're in a shared building or office, just to inform building management so that they can take any precautions that they deem necessary if they're shared, elevators or doors, just to make sure that everything is cleaned properly. So another question that we get a lot from doctors is, do I need to report this case to the CDC? And the answer is no. The physician that or the healthcare provider that receives confirmation of the positive result is the mandatory reporter. So there's no obligation for dentists to report any of this. And like Jordan said, policies that need to be implemented, we certainly agree that revised policies should be added. And one of them should be that any employee who becomes ill at work or outside of work with coronavirus symptoms must notify their supervisor. And if it's outside of work, when they have these symptoms, they should not come in. They should call the practice. They should inform, just to keep as many other employees and patients safe.
Lauren and Jordan, thank you. Lauren, I will come and expand a little bit on what you're just sharing as well, because this has already occurred in practices, and I'm a hygienist. I'm seeing patients with social distancing and with every PPE and with every CDC and ADA guideline in place, from a hygienist, the most vulnerable. But now I am being notified the patient I just saw is COVID positive. And now I'm the hygienist and I saw them, and I'm afraid of coming back in the office, or I'm afraid I may have COVID, but I don't have any symptoms. So as a revenue generating producer, as a provider, what measure should we be taking? And again, it could be a doctor, it could be an assistant, it could be front desk, but in this scenario, this question was very specific to the hygienist, which is the provider in the practice. How can we handle that, or how should we handle that?
Sure. I mean, honestly, there's no clear, legal requirement to do, to take any action. I think that what the CDC recommendations, kind of in line with most recent compliance, is that you would send the employees who closely treated this patient home. I think it's if there's no symptoms, remain home for 3 days, make sure there's no fever, nothing that comes up, and come back. There is this incubation period where it's 3 to 14 days. And so the safest course would be to stay home for 14 days and make sure that there's no symptoms. Because yes, it is a hygienist or a doctor that you may be losing, but it may be a lot better than risking the health of the entire office and all of the patients that they are to treat next. So, from a PR standpoint, as well as a legal standpoint, I think it's probably best to kind of exercise precaution and err on the side of safety and the health of your staff.
So to confirm, Lauren, 14 days would be paramount. That would be the best scenario, but 3 days, 72 hours is your minimal, just to ensure symptoms do not come about. And again, we don't know if this would be an asymptomatic situation here, but again, the system, at least systematic or 72 hours is what you're referring to.
Correct.
Very, very good. Okay. I appreciate both of you. I know that's a lot in regards to just our staff, but I'd like to change gears a little bit into PPP, because many of us did apply. And when I say us, I am the people on this call today, right? Applied for EIDL loans, which is great. And then also coming in with PPP. And that has been just a navigating situation. So some of the questions, and I know Jim's teeing up more questions as they're coming across, but we have one here. It says, my PPP loan was to be used today. Okay, well, today's Wednesday, the 10th. Yeah, I can see very many of them where their 8-week period was up. But now with the extended time frame, how do I record and or use those funds for payroll that I might be processing on the 15th or the 1st of 15th of this month or the 1st of next month? So Lauren, I know this is, there's a lot of moving pieces with PPP, and we're still waiting on documentation of what we're supposed to be doing. So let's start with you and see what support you can give us or share with us in regards to PPP and the extended time frame.
Sure. So a lot of changes. This has kind of been an ever-evolving situation with the use of these PPP funds. of course, the prior guidance gave you an 8-week covered period from the date that that PPP loan was dispersed. And you had to use the funds within that period. Of course, with the amounts that were provided, right, 2 months of payroll plus another 50%, it was going to be tight, kind of no matter what. And so now with the new rule, the 7010, it's the earlier of 24 weeks from the date that that PPP loan was dispersed or until December 31st of 2020. So the covered period is now expanded. We certainly are working with a lot of CPAs, and for some practices, it may make sense to go ahead and try to seek the loan forgiveness after 8 weeks if you have complied and you believe that a large portion will be forgiven, because then you get this loan off your books. You can potentially get some conventional loans if you need it later, right? There may be some benefits to going ahead and not dragging this out. But at the same time, with the new laws, it relaxes it significantly and allows the use of those funds for 24 weeks. So you can continue to use those funds for payroll for a much longer period of time.
So Lauren, just to confirm, so my 8 weeks up today, but I do have payroll that I'm going to be paying on the 15th. So I'm going to be processing payroll on Monday, but my time was up today. I actually don't need to pay that payroll early to satisfy my 8-week window. I can actually wait, process my payroll normal, and generate that payroll. That might have exhausted my 8 weeks and exhausted my grant, if you would, in PPP. So I've done what I need to, but at least I got that one more time frame in. Is that correct? Is that what I'm hearing?
Correct. Yes, absolutely.
And then the other part to that, not a question here, but just for curiosity, that extra 50%, most were using that for the lease, or they were using that for utilities, internet, things of that nature. Same thing. Am I able to stretch that forward so I can pick in this one more month of July? Because I typically pay those sort of utilities that first week, second week of the month. Instead of paying them in advance, I could wait and pay them in July, keep everything on cycle. So I've gone from my 8 weeks to 9 or 10 weeks.
Right, absolutely. So the covered period now is no longer 8 weeks, it's 24. So you can use those funds in the same way that you were before. There's also additional regulations that have changed. So whereas before you had to use a minimum of 75% of the loan amount to with payroll costs. So now, and a maximum of 25% on the non-payroll costs that you just mentioned, like rent. And so the laws have changed. The minimum now is 60% to be used on payroll costs, with 40% can be used for non-payroll costs. So again, it provides greater flexibility for offices, and hopefully a greater potential to get a larger amount forgiven.
Lauren, thank you. I know it's a lot. We have other questions coming about. So Jim, if you're pulling those questions for us, if you would not mind just sharing, and Jordan, yourself, or Lauren, either one can pick these questions.
Okay, so from Gerald in the audience, is the paid leave benefit for childcare for full-time employees only? So I'll leave that up to the panel, how you want to address that.
I'm happy. Go ahead.
Go for it, Lauren. Go for it.
Okay. So no, the paid leave benefit is not for full-time employees only, but the paid leave, so if the employee, let's say, worked 20 hours per week, it is an equivalent of that number of hours per week for the period of time. So if it's a 12-week period, you would pay for 12 weeks the equivalent of what their pay was. If this employee worked 15 hours, right, however many hours they worked per week, they're paid, and it's 2/3 of that amount.
And to piggyback off of that a little bit, that all these numbers are going to be broken down into an annualized format. Now, this is not me going on a soapbox. This is just the way it is in 2020. If you are a firm that processes payroll in-house, or you use an outsourced service that doesn't have a lot of technological savvy, a lot of this is going to be a manual process for you. My main aim to you is this. This process alone can be completely automated with an existing system. If you don't have one already, this is a great opportunity for you to at least look at what's out there, because a lot of what you're going to have to manipulate in terms of dollars, cents, percentages, all of this function. If you hand it off to your accountant, it's going to take them a while. There are systems in place that can automate these procedures that are going to wow you. And once you see the cost associated with them, you're going to laugh, because the amount of time you spend actually doing it yourself versus an automated system that can also guide you, it's going to change your life.
Jordan, I have a question for you, and this is from clients as well. Should I trust? I am using a service, and the service has provided me payroll processing, but now all of a sudden they are keeping my PPP records. Don't worry about it. I'll take care of all the records. I'll send it to you, and then you'll be able to justify, if you would, that this is a grant. Should I trust that agency that they'll do that for me, or should I really listen to my bookkeeper that I've had for 20 years that says, no, we'll just do our own ad hoc reporting? What should I do there?
Phenomenal question. The answer is a little bit of both. The organization that's handling this for you, you're going to know very quickly if they know what they're doing, or they're just ultimately kind of passing you through the blender. The services that are going to ultimately take care of you best are the ones that not only educate you, but are also going to be actually in the weeds with you, not only ensuring that you have what you need, but also ensuring that your your payroll reports, all of your functionality are in line with what you need. So the correct answer is never trust anything 100%. Always get multiple pairs of eyes on it. But yes, if you've got a great company that's going to be with you from section 1 to section 7010 here, you're in good spade. But always listen to as much resource as you can. But if you've got a system that's going to carry you the whole way, use it, but also use the guidance on the side of the fence as well.
Hey, Lynn and team, we do have someone who raised their hands.
Yes.
And I've unmuted them, but they've got to unmute themselves. So Hong, on your, I want to let you ask your question to the panel using your microphone, but I've unmuted you in my end. You've got to unmute yourself too as well. So go in the Zoom panel, hover over where the microphone button is, and unmute yourself, please. Okay, well, I tried. And Hong, if you want to ask your question, you're going to need to unmute your line. So let's go back to the questions that we have here. So from Anne, what additional documentation regarding COVID-19 precautions should be included in clinical notes?
Lauren, I'm not for sure if you'll have that, but from a clinical note, there's not been a lot of clarity in regards to that. Is there anything that from a legal standpoint you're looking at from a compliance? So we're going to now put on your compliance hat.
Sure. So, I mean, at this point, what we recommend, of course, the temperatures are, most of our clients are taking temperatures at the door, right? Those are logged. Those records should be included in the patient's chart. I would, there's differing payers that some are willing to pay for PPE, a lot of them are not. And so, of course, that's documented for those purposes. Some clients are charging the patients for the additional PPE. Because they need to pass that expense somewhere. So of course, for all of those reasons, it would need to be documented. I mean, I think at this point, right, it's going to be just prudent to document, this patient signed a consent form. They have not traveled to these certain countries. They've not experienced any of these symptoms. They're not caring for someone that's positive, right? So just shows that you're doing your diligence there. And then documenting, this is the level of PPE that I use during the procedure. I understand that it's a bit more tedious, but I think that just as an exercise of caution, it's definitely recommended in these times.
Lauren, thank you for that. And let me just ask, and expanding on that a little bit, would it be fair to say, and I could be absolutely wrong here, so I'm going to put on this operational hat, we do update health history. And so health history, and if we think back a few years ago, we had Ebola and we had all of that, that we had to do some pre-screen, if you would, before the patient could come in. So would it be fair to say, yes, we have resources such as CareStack, the virtual check-in. So we've got the little checklist of, do you have these symptoms and so forth. As you've mentioned, we're taking temperature, we're recording that and putting it in notes. So we know that when they presented themselves, there were no concerns. And then we've gone ahead and taken care. Would it be fair to say that it would be probably a best practice to just be updating health history forms at this moment in time? And do you envision in our health history forms that we'll be required to have a COVID section as we did when we were looking at other scenarios in the past?
Absolutely. I mean, I definitely think that that is going to best protect these practices, right? We haven't yet seen claims, but they certainly may come from patients. It may be hard to kind of prove where COVID-19 was contracted if people are going to the,
Right.
the grocery stores and things like that. But it certainly is going to be beneficial to track this. And to the extent that it can be updated in a health history form, I mean, it's definitely a precaution that would be worth taking at this point. And then, hopefully nothing comes of it, but you've got the documentation to back you up.
So Lynn, another question we have here, and this might be more posed for you, is looking for, you mentioned in your introduction that you work with a lot of groups, small, emerging, some of them more established. Any best practices that you can share with the approaches that these groups have taken as they've reopened in certain parts of the country?
Jim, thank you. And whomever is asking the question, I appreciate that. Yes. Best practices is really at this moment in time, and we didn't, for the clients I work with across the nation, and they're all sizes, small, when I say small, a solo practitioner and their single practice to multiple units, which could be many practices, and we know them as the larger DSOs. My space is primarily in the emerging DSO or the invisible DSO, which is more shared services because doctors own everything. But what we've taken full advantage of is during this time that we were actually closed, if you would, due to COVID, is revisited all of our standard operating procedures, starting with compliance, and that's being from OSHA, infection control, as well as moving into bloodborne pathogen in our training. Did we have everyone trained for our annual training? Did we have all of the way we should be doing business? Was that very clear? Then we had the interim, of course, the CDC along with the ADA. There was debates and challenges because how do you take CDC into a dental office? So we really complied more with ADA. But in that regards, we have interim guidelines and making those very much part of the active living standard operating procedures. And as Jordan may mention, as the team was coming back in, having a day of compliance training, teaching people really how to wear PPE, because let's just be very realistic. The hygienist having to wear as much as they're having to wear was not something normal. For the doctor to actually be in a shield was not something normal. For the front desk to actually be in a mask or behind a barricade or even wearing a shield, not at all normal. So really modeling that, making sure that there was some fit in that as well. And what I mean by fit is how do you really wear a mask? If you've never worn one before and you've seen the dental assistants and doctors always wear one, but you've never worn one as an operator, what does that look like and how do you do? So short answer is take the time, revisit what you should have been doing as basic standards, and then make these interim changes in place. I will also make mention to what Jordan was sharing, the employee handbook, best time to visit. And if you're using a service, have that service support you and guide you. If you're not using a service, you can find this out there, as well as update all your employee handbooks. Having the documentation that I went over these policies in a signature, though, is very important, that you've educated your team and you have accountability there by signature or recorded. Many of these have been recorded as well, just like what we're doing today, but having those pieces. And I'll close this particular piece with that's what Black Ops Management Solutions really specializes in, is to ensure that we are efficient in what we do in our dental practices with standard operating procedures and playbooks. And playbooks are, if you would, the behaviors that I need to execute to do my job. So it's really all of those tasks that I need to do. So thank you for asking that question. And I do believe, Jim, we have more questions there. I think we have time.
I don't know if the other people on the panel wanted to address that too as well from the group perspective. Jordan or Lauren, if you want.
Yeah, so much like Lynn, I deal with a tremendous amount of emerging businesses, and I also have a pretty large amount of clients who are either scaling up or really are a little bit too big and they're trying to scale back down. But for the purposes of dealing with COVID and all of the policies that are going to be changing and manipulated, to echo Lynn, I've got staff members who do nothing but work with clients daily to help them understand not only what's necessary federally, locally, and within whatever area they're in, but what works best for the employee as well. Because at the end of the day, as an employer, our goal is to keep them safe, and keep them happy and ensure that they're relegating revenue. Employees, completely different. They just want to make money, make a living, and go home at night and be safe. So we really need to echo those chambers. And for scaling businesses up, I'm the first one that's going to tell you this. You got to have a plan in place. You got to have a solution where you can manage all of your data and grow that data organically and congruently with your policies and procedures. If you're not doing that, you're wasting a little bit of your time, but more importantly, you're not really growing as a business. You're staying in the same place. So the whole purpose of this aligning of meetings is to really help you get out of the craziness of this and help align best practices going forward.
Lauren, would you like to add some things?
Yeah.
I honestly think that you both have covered it pretty well, and I agree with kind of the guidance that's been offered. So I don't really know that I can add too much more that would help everyone.
No problem. I put everyone's email into the chat feature here. So if you want to reach out to these people individually, take a screenshot, or you can just cut and paste those email addresses. And so the other question I have here is about situations of where someone, and Lauren, maybe you can address this, or maybe it could be for all panelists, where staff members have pooled together and come as a block, post-COVID, and said, hey, we don't want to come back unless XYZ condition is met, and have organized. And so I know this varies state by state, but hearing a lot of third-party stories about this occurring, and I don't know if you have any tips or pitfalls to avoid if that comes up in the course of a conversation.
Yeah, so this has occurred with several of our clients, unfortunately, and the doctor has sort of lost control of the office, and it's now taken by someone that's leading this group, and sometimes, our doctors will be sending out emails about how we're going to, address everything safely, and we're following these guidance. And then, another employee will send another blast to everyone, kind of contradicting it. So it really is a fact specific determination as to what you can do. And again, provided that the safety procedures, OSHA compliance, the CDC compliance, right, that everything is kind of in line. You're doing the best that you can. You've implemented new policies, and you've explained everything to the employees. There's new cleaning procedures, right? That all of these things are implemented. In that event, it's, you can kind of on a one-by-one basis potentially, discuss with each staff member, and you may be able to terminate. I mean, I actually have a client who lost all but one team member, and is rebuilding. So, but it's just, at some level, they had to get back to work. They needed, just to keep the business alive, they needed to be able to reopen, and the patient demand was there. And so, with all of the employees refusing to work, something had to be done. So, of course, you cannot run afoul of employment laws, of OSHA regulations if they are making, legitimate complaints. But short of that, then there are actions that can be taken to remedy that.
And if I may, and Jordan, you might want to answer this more on an HR standpoint, but Lauren, as you made mention, prior to COVID, we could be looking at that as insubordination. If we've effectively communicated and we did share standard operating procedures and playbooks, so we made sure there was education, and then the team still kind of had some sort of disagreement, that could be insubordination or something of that nature. So if we really look at pre-COVID, we took care of HR issues, but now we seem to be sensitive and hypersensitive, if you would, because everything's COVID-19, everything. We just kind of seem to put it. Would that be fair to say from either one of you, Jordan? I think we'll start with you from an HR standpoint. I'm sure you're dealing with those issues. Give us some guidance there.
100%. Almost all of our offices we deal with have had some level to deal with this. What I personally discuss, I'm PHR certified. I've got SHRM certified individuals that really go even more in depth. But simply put, notate what's being discussed by whom. Also, if you need to render discipline to insubordinated employees, do so. Because at the end of the day, people do not leave companies. People leave the way they're managed. So if we can manage these situations and be proactive, even if we're dealing with a situation where they're grouping, you can usually get rid of a group very quickly by saying, Excellent. Let me understand your viewpoint. Let's discuss it. I want you to understand my viewpoint. Commonality is huge in business, as it is with owning business, having employees. If your employees understand your messaging and it's not a dictatorship, most things are going to go well. The big differentiator is you need to communicate and notate all communications to and from. If you're doing that, you're protecting yourself, but more importantly, you're protecting your employees from themselves. So if anyone wants to talk more offline on that, we could go for hours, but this is a big topic for myself and Lynn, and we discuss it daily.
Jordan, thank you. And I know we have just a few moments and we'll be wrapping up our call today, but Jordan, Lauren, thank you both very, very much for your participation and providing your expertise. Questions are always happening. And as made mention and Jim shared, our email is there. We are very much open for you to share with us your questions, your concerns. We do have these webinars, if you would. They're free. They're live webinars just to keep you informed, keep you educated. We do have our second part of this two-part webinar tomorrow, specifically to increase our patient confidence. You know, it's one about getting our team back and getting everybody in place, but we need the patients in order to pay that team. So tomorrow, you're very welcome to join us. We will be visiting with two different people tomorrow. We're going to talk about IT. It's all about HIPAA and it's how do we do what we do now? Yeah, more virtual, as well as we're going to have TNT dental marketing, which is how do we market our patients and build confidence there. So it's really a presentation around HIPAA and IT as well as for marketing. So please join tomorrow. And again, with that, I'll come back to you if I can, Jim, but I'd like to just say on behalf of Black Ops Management Solutions, as always, we're very supportive and appreciative to what CareStack is providing us a platform to share our messaging and our support out there, as well as what we're getting from Jeff, of course, with Darby. So thank you both for your constant support. And Lauren and Jordan, thank you. And I know we'll be talking with you in the near future. Thank you very much.
Thank you, everyone.
Thank you.
On behalf of CareStack and Darby, I want to thank all the panelists today. If you wanted to learn more about CareStack, we're having what we call a virtual trade show. It's on June 15th, not July 15th. I just caught that. My apologies. And that's a group setting. Think of it going to an exhibition. There's no one putting you in a headlock. It's not a one-on-one demo. You can come and go as you like. And we do offer a gift card for attendance. So if that's something that you're interested in, you can email me back. You'll get an email from me, or you can go to carestack.com and register there. But I want to thank Lauren, Jordan, Jeff, and Lynn for a really great program today. Continue to stay safe and healthy. We hope to see everyone tomorrow. Thanks, everyone.